Greasy pig disease, also known as exudative epidermitis, is a highly contagious bacterial disease which affects the skin of pigs, especially piglets. Etiology. Staphylococcus hyicus is a gram-positive bacterium which can be found in the vaginal mucosa and skin of healthy sows, as well as minor abrasions, such as bite wounds, on the skin of piglets. Both of these are potential routes of entry for this bacterium. However, the other possible route is related to stress. Such factors include agalactia in sows. This is when the sow cannot produce enough or no milk for her piglets, intercurrent infections such as ringworm or nutritional deficiencies, and the weaning of piglets. There are two susceptible hosts for both the acute and chronic form of GPD. The acute form is found in sucklers and weanlings up to the age of 3 months, whereas the chronic form is found in weaned pigs. Clinical signs. The initial signs for GPD are listlessness, dehydration, and prominent redding of the skin in one or more piglets in a litter. You need to look for the areas where the skin thickens, look for any macules that are forming around the eyes, nose, lips, and ears. You will also identify that this is GPD as the body will be covered in a moist, greasy exudate of sebum and serum, which will eventually become crusty and itchy. Sampling and testing. Usually, diagnosing GPD is based on the clinical signs that the pig or piglet shows. However, in your more severe and unique cases, the laboratory can isolate and identify the Staphylococcus hyicus bacterium by cultivating it in a bacterial culture. Control and prevention. To control GPD, you have to isolate the affected pigs, as well as disinfect any buildings they were in or equipment used on them. Also, you must wash your cells with an antiseptic soap before they start furrowing. For controlling and treating of any bacterial infections, you must use antibiotics, and for any skin lesions, you must use antiseptic medication. This could be in the form of a cream or a spray. For severely dehydrated pigs, you need to give them fluids and electrolytes. In water or in feeding medication can be given as well for 3 to 5 days so that it can control any outbreaks after weaning occurs. Finally, it is important to provide pigs and piglets appropriate ventilation so that humidity can be avoided. Important things to know about GPD. Most of these lesions are caused by injuries from pigs or piglets fighting with each other, or from walking on abrasive surfaces such as new concrete. Factors which increase the severity of GPD are immunity, nutrition, hygiene, and the presence of mange mites. The mortality rate of this disease is not very high. However, if very young piglets are left untreated, this will lead to their death. But if a piglet is able to pull through this, it will have a very slow recovery, and its growth will be delayed. Mature sows will have a high immunity because of their past exposures to GPD. This means that when the piglets drink the milk from the sow, the colostrum will have the antibodies to help give additional protection and immunity, which means that the piglets are less susceptible to GPD.